This is an overview for the long-term care resident. It includes our aging population, long-term placement, reasons for admissions, expected length of stay, adjustments, living with a chronic condition, and the young resident. Our aging population. Our aging population. There is an increase in the number of residents in ages 65 and over. Right now, there is 1 in 9 persons that are over the age of 65. There is also a gradual increase in the number of oldest old. The future aging population in the United States is based on statistics. Who lives in a long-term care facility? Long-term care placement. 1/3 to 1/2 of all people in placement are over the age of 65. Advancements and improvements in healthcare causes people to live longer. Advances in medical care allow for recovery from conditions that people used to die from. Types of illnesses and conditions. There's acute illness, chronic, and degenerative conditions. Factors leading to long-term care admissions. The largest population living in the long-term care facilities are diagnosed with dementia. Diabetes is considered a chronic condition also. Reasons for long-term care admissions. There can be the lingering effect of an acute illness. There could be the need for continuous monitoring and treatment for one or more chronic conditions. There's a need for meeting one's physical needs, for instance, because of a degenerative condition, dementia, or it's just no longer safe to live alone at home. Until the mid-20th century, many more people died from an acute infection because there were no antibiotics available. Question 1. The need for long-term care is expected to stay the same in the future. True or false? The answer is B, false. The need for long-term care is expected to increase in the future as individuals live longer and many have chronic conditions which they will require assistance. Expected length of stay for long-term care admissions. Types of admission. Short stay admissions related to the early hospital discharge. They receive care until they are able to go home, and it also saves healthcare costs. Types of admissions. Extended stay admissions are those with physical or mental disabilities. They need help with ADLs, IADLs. They have coexistent medical conditions, and there might be cognitive impairment. Adjustment to long-term care. The resident. They may not have any placement planned. They may be coping with multiple losses. They may suffer from fear and anxiety. They may suffer with the loss of independence. The resident can have some good days and some bad days. When interacting with a resident and the nursing assistant senses the resident does not appreciate their presence, the nursing assistant should respect the resident's wishes while still trying to make a connection. The nursing assistant should try to get to know the resident personally. The family. There's an adjustment to the necessity of the admission. It's difficult on the family. There's struggles with change in the resident's condition. Often it causes family conflict. There's changes within the role of the family. For instance, the child is now the caretaker for the parent. There's a responsibility of the primary caregiver, and at times one partner will be losing their life partner to a facility admit, and there's giving up the role of primary caregiver. If you were at home with your parent and you need to give up the role and hand over the responsibility to a long-term care facility. The nursing assistant can encourage the family to participate in the resident's care to the level in which they are comfortable, of course. Living with a chronic condition. Coexistent medical conditions are defined as being treated for one or more medical condition. Effects of a chronic condition on the resident. It affects how the others perceive the resident, long-term medication usage, there's going to be lifestyle changes, and there may be a battle for pain relief. The young resident. Young residents become bored easily and they need help to relieve their boredom. So think ahead and plan appropriate activities. A young person living in a long-term care facility may likely have the diagnosis of cerebral palsy. The young resident's reason for admission is a physical disability, just as we discussed a motor disability, cerebral palsy. It can be a traumatic injury or a developmental disability. The adjustment process for young residents. It takes the young resident longer to adjust. They may act out to gain control over their life. There's different methods to assist the young resident in coping. They also have or could have issues with sexuality and intimacy. If a resident makes an inappropriate comment to the nursing assistant, always remain professional and set boundaries. Safety. If a person is a candidate for a long-term facility, the first factor taken into consideration when moving their person is safety. Quality of life. OBRA protects the quality of life. The nursing assistant can help with activities. They can find out what type of hobbies the resident liked prior to admission. They can help them to get to special events, encourage them to interact with other residents, and allow the resident to assist you in their daily care. Question 2. Caring for a younger individual can pose a unique challenge for healthcare workers. Which of the following should guide your interactions? A, it's okay to be friendly with those your own age. B, always be professional with all interactions. C, spend time with them, giving someone to talk to. D, all residents and patients should be treated exactly the same. The answer is B, always be professional with all interactions. Caring for a younger resident can pose some unique challenges for the nursing assistant. Although it is important for you to have a friendly, warm attitude toward your residents, always set clear and professional boundaries. The end.